Our presentation tonight will be by Dr. Nicole Culos-Reed, who is an associate professor in the Human Performance Laboratory at the Faculty of Kinesiology, University of Calgary. And she's joined by her postdoctoral fellow, Dr. Heather Leach. And they have the podium starting now, and we're looking forward to your presentation. And they are recruiting for a trial, and I can promote that trial, I guess, and hopefully many of you will take interest in what they've got to say, and in particular the trial.
Great, thanks, Stuart. Can everybody hear me? Perfect. Alrighty, first I'd like to thank you, Stuart, for the invitation to come this evening. I'm going to talk about the role of exercise in cancer survivorship, and in prostate cancer in particular. And then Heather's going to come up in just a little bit and talk about our ongoing trial, and then we'll wrap it up. So I'm really going to move through, oops, sorry. I use a Mac, so we'll see what happens here. Okay, so I'm going to go over some of the background and the role of exercise in cancer survivorship, talk about the evidence specifically in prostate cancer, then let you know about some of the resources and some of the tools and tricks for the trade. We're going to talk about our study, and in particular, we're going to tell you about some exciting work that we're just embarking on with Prostate Cancer Canada and their lifestyle management solution. So to get us started, I've got just a little video clip I want to show you. How many of you have gone on and seen a video called 23.5 hours? Has anybody seen this? No, okay. Let's see, I put it down here.
Hi, I'm Dr. Mike Evans, and welcome to this visual lecture I'm calling 23.5 hours. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all of these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes, and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the #1 treatment of fatigue, and of course the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine, and what is 23.5 hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour, and that if you can do that, you can realize all the benefits I've described in the previous slides. So let's just take a quick walk through some of the literature. So Stephen Blair, he's a professor at the Arnold School of Public Health at the University of South Carolina, and he looked at this in what's called the aerobic center longitudinal study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is a kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if that specific risk factor had been erased. So for example, turning a smoker into a non-smoker, or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important, and so on and so forth. But the one that was that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important. Most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension or high cholesterol or diabetes, and we rarely see fitness thrown into the mix. And so it's nice to see a trial that's not so siloed. Blair's work is interesting. He also did another trial looking at obesity. What he found was, sort of two things. One is obesity and no exercise. That's a very bad combination, and that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss but were just active and obese, that was much, much better, and that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush, and so we see big differences when somebody goes from not doing anything to doing something, and after that the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down, so it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise, so it can be broken into 3. Higher intensity, it looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth.
Okay, so there's actually a few more minutes of the video, but I'm going to stop it there because I think it gives you the gist of the idea. So if you want to watch the rest of this, there's about 3 minutes left of it. It's YouTube, and you just want to Google 23 and a half hours, and you'll come up with Dr. Mike Evans here. Back to our slide. So I love this video because I think it really nicely shows the importance of regular physical activity in terms of the association with our health benefits. And he doesn't talk specifically about the role of exercise in cancer, but he talks about a lot of the diseases that are often comorbidities in cancer survivors, so obesity, diabetes, heart disease. So just to kind of set the platform, I'm going to probably use the two terms interchangeably, but really when we look at the literature, you'll most often see one of these two used, physical activity or exercise. So physical activity is any movement that you do throughout the day. So if you walked in from the train, you took the stairs up instead of the elevator, those are all examples of physical activity. Exercise is a more specific subset of physical activity that is structured for achieving health benefits. So it's the portion of your day where you're specifically going out to engage in movement for your health. That is exercise. A lot of the research is looking at specific exercise programs, but the message that I really want you to leave with tonight is that any movement is good for your body, and the more you can be regularly physically active during your day, getting that up to 30 minutes or more every day is what is going to provide health benefits. So it doesn't have to be the structured going to the gym, although that is great, but just leading an active lifestyle is really what's important. And so just to give you a snapshot of what we know from the general physical activity in cancer literature, and for those of you who have are going through or have gone through prostate cancer diagnosis and subsequent treatments, you'll recognize that many of what cancer negatively affects is on that left-hand side of the screen there, right? So changes in body composition. We see decreases in lean muscle mass, increases in fat mass, which obviously subsequently affects weight management. The number one reported negative effect across all cancer types is fatigue, and it's that debilitating fatigue that keeps you from engaging in your normal daily activities. And associated with the fatigue is issues with the actual sleep and sleep quality. Then we have some areas of impact related to fitness. So we know individuals become more sedentary throughout a cancer diagnosis. And with that, we'll see decrements in cardiovascular fitness, muscle loss, changes in bone strength, and especially in this prostate cancer population, we see osteoporosis links. Then we see some emotional distress issues, depression, anxiety, stress, right? All these indices of emotional distress that are very common with a cancer diagnosis. The ultimate impact is decreases in quality of life. Your overall quality of life that's made up of many of these subcomponents is negatively impacted. Your regular physical functioning and mobility, your ability to engage in those chosen activities of daily living can be negatively impacted. And really survival, so morbidity and mortality are impacted with a cancer diagnosis. The good news on this other side of the screen is that for everything that cancer negatively affects, we have substantial evidence for the role of physical activity. Okay, so we know we use physical activity, for example, to maintain ideal body composition, to increase our lean muscle mass, decrease fat mass. Okay, physical activity and nutrition are the two tools that you must use to achieve that nice balance. But we also know that, for example, exercise is one of the best things that you can do for emotional distress, for depression and anxiety. Okay, there is literature suggesting that exercise is as beneficial as traditional pharmacological treatments, drug treatments for depression. And the bulk of this research really has looked at that endpoint. Can we use exercise or physical activity to enhance overall quality of life? And the answer is yes. So I'm going to show you just what I mean by that. So these are some of the traditional domains we see in quality of life, and we have evidence in the exercise literature for the positive impact of exercise on the physical domain, psychological domain, social domain, and spiritual. So most of our evidence is physical, which makes a lot of sense, right? We know exercise can improve function, can improve well-being, can improve those indices of fitness, so strength, cardiovascular activity. We know exercise will decrease fatigue, which is often in that physical domain of quality of life. And then we see psychological improvements, and we have quite a substantial body of literature which also suggests these improvements. So people tend to engage in exercise for the physical, right? We're doing it to stay trim, to keep up our movement, to keep up our mobility. But I think just as important is the role of exercise on these psychological domains. Okay, exercise is a great tool for reducing stress, okay, for improving your sense of well-being. The big one there, and really the whole reason I got into exercise and cancer research, was that feelings of control. When someone is diagnosed with cancer, all control often goes right out the window. Okay, you could have come in being very healthy and got cancer, or come in not having the healthiest habits and got cancer. Either way, right? Cancer sometimes seems to have no rhyme or reason. Okay, that feeling of control is gone. You're put into a system for good reason. It's a system that is there to fix, to cure. Okay, but you have no control or very little control in that. You're in that system and you go through the steps that the doctors tell you you should do. Okay, one of the biggest reasons that I think exercise can be beneficial, and this is borne out in the literature, is that sense of control it can give people back. Well, if I can engage in my 10 minutes of activity, then maybe I can do those other things that are important to me. I can get back to work, I can play with my grandkids, I can do those other things. So exercise really does afford that piece there. Less evidence, but still I think pretty important, is the social impact that exercise can have. So not only can we engage in these activities in a social environment, so just like in a support group setting, we've done trials and others have done trials bringing men with prostate cancer together into a setting, and it can be very supportive and social for them. But even outside of that setting, even if you just work out with a single workout buddy or a partner from home or a friend that you meet, okay, we can get a nice social aspect that can be just as beneficial for some of those outcomes as the actual fitness itself. And then less evidence, but still a growing area of research, is looking at kind of the spiritual and the well-being domains of quality of life. So we don't have as much evidence there. It's not traditionally been an outcome that we associate with exercise. But for example, some alternative forms of exercise like yoga and Tai Chi have been shown to have these mood-enhancing properties and this sense of well-being and fitting in with a bigger picture kind of impact and benefit that we're seeing associated with them. As I've mentioned, the #1 complaint across all cancer survivors is this issue of fatigue and debilitating fatigue, not being able to engage in your normal activities of daily living. So it's the #1 reported side effect. Unfortunately, you can see there, 94% of oncologists will treat pain, but only 5% report actually treating fatigue. And that's because we don't often know what is causing the fatigue, so they don't have a prescription they can give for your fatigue. Okay, the fatigue is really part of this vicious cycle. So what's the first thing you want to do when you're tired? Sleep, sit down, watch TV at the end of the day, right? What's the last thing you want to do? Exercise, right? You don't want to move because you're tired. You want to rest, right? What actually happens is that physiologically deconditions your body. So you're tired, you sit and rest. That sitting and resting physically deconditions your body. You actually end up being more tired. And so what you get into is this downward spiral, this vicious cycle we like to call it. Okay? The best thing that you can do for the fatigue is to work out, to move at an appropriate level. And that's really the key thing that I'm going to talk about when we move into some of the resources in prescription. Okay? But exercise and physical activity and just movement in general can really be used to help manage the fatigue. So other than quality of life, this is kind of the biggest outcome and impact that we're looking for in many of our studies, is this fatigue issue. And then this is where really the research is going. So if I have cancer, what can I do to decrease my chance of recurrence, to live and survive longer as a cancer survivor, right? And so we have very convincing evidence. First evidence came in breast, then we had colorectal, and then prostate and ovarian. And what we have seen to date is that there's a significantly reduced risk of cancer recurrence, significantly reduced risk of cancer mortality, and significantly reduced risk of all-cause mortality. Now, unfortunately, I'm just noticing that I had updated this with the prostate specific, so I'll just tell you quickly about the study. So researchers in 2011 in California did a prostate-specific study. So they looked at the incidences of progression, recurrence, and deaths from prostate cancer. They had over 1,400 men in this study, and they looked out over a span of 15 years, and they ended up with 120 incidences of recurrence or progression. Then they looked at activity level. And what they found was that for men who engaged in approximately 3 hours a week of brisk walking, and that was the key, it was brisk walking, it was not slow walking, and this is self-reported, so men just reported how quickly they walked in different categories and for how long. 3 hours of brisk walking reduced their risk of any of these events, so progression, metastases to bone, secondary tumor site, or death, by 57%. So men who were in that active category, 57% lower risk of recurrence, progression, death. Okay, so pretty substantial numbers. In breast cancer, we see about the same thing. We see for women who are moderately active in that case, who engage in regular walking for about 150 minutes a week, so that's 30 minutes most days of the week, they see about a 64% risk reduction in breast cancer specific mortality. Okay, so that's really where this evidence is really moving towards. Oh, there's the slide there. I broke it into 2 slides apparently. So physical activity after diagnosis is consistently reported. So the key message really for this, I guess there's 2. It's brisk walking, so actually moving so that you're breathing harder, breathing deeper, that level of intensity. And the second is it matters what you do from your diagnosis onwards. It doesn't matter what it was before that. Okay, so from diagnosis onward, what can you do for your health to decrease the chance of recurrence and improve survival? Okay, so that is great news because it is something that is 100% under your control. Okay, it's not under somebody else's control. It's not a pill you have to take. It's a behavior that you can engage in to reduce your risk. So as we're starting to potentially understand survival and the benefits of exercise, really the logical next step is, how is it working? You know, is it related to our fitness, cardiovascular fitness? Is it related to weight issues? And there's been a couple of things that have been looked at. The big area is the anti-inflammatory effects of exercise. So we can look at cytokines at a cellular level. For breast and prostate in particular, we're looking at hormones, because these are hormone-related cancers, so there's a potential mechanism there. And then the third really area is this idea of enhanced immune response, so you're strengthening your system overall with exercise. I can tell you, as a follow-up to that 2011 study that looked at that 57% risk reduction in men who are engaging in brisk activity, one of the mechanisms they're looking at is actually changes in the structures of blood vessels. So men who were more active had more normal-looking blood vessels than men who did the lower amounts of physical activity. So it's an interesting area that they're really starting to try to grapple with and understand. So if we want to look more closely at men with prostate cancer and exercise, there's really kind of two groups in here in the research. So we've got the group that about 50% of men will be diagnosed with more advanced cancer and have hormone therapy, androgen deprivation therapy. And then we've got the men that are not on androgen deprivation therapy, more localized cancer. And the research really that we've done here in Calgary has really been focused on the men with hormone therapy and ADT. And while we know that ADT can be very beneficial in terms of survival and disease control, we know that it has negative impact on many of these areas. So it negatively impacts muscle mass, which in turn impacts physical function. Quality of life and reports of fatigue are exacerbated in men on ADT. And then the bone mineral density issue and the issues with osteoporosis and risk of fractures that goes up is also associated with ADT. The good news, again, is that exercise can be used to combat many of these negative side effects that are associated with ADT in particular. And so beyond our work, there's been a number of studies. There's probably about 45 studies total looking at localized prostate cancer and more advanced cancer. And in general, just a quick summary is that we see a range in the types of programs done. So anywhere from 8 weeks up to about 24 weeks. And doesn't matter whether we're looking at shorter programs or longer, we tend to see after 8 weeks and beyond that we can get these benefits in terms of improvements in quality of life and fatigue, improvements in bone mineral density, and improvements in that muscle mass and physical function. The big key with these is a lot of these studies don't have long-term follow-ups, and what we know with exercise is really it's that use it or lose it phenomenon. If you don't continue to exercise, those benefits will all disappear. In localized cancer, we've had programs up to 1 year. So we get longer programs in that population, and we see similar benefits here. So we see quality of life benefits, fitness benefits, and we see emotional well-being and overall well-being benefits as well. So just to give you an idea, this was the last review that came out, and it was in 2012 by the group down in Australia. So they've got a very large prostate program in Australia. And this study reviewed what had been done to date, looking at the impact of exercise during treatment for physical and psychological effects in prostate cancer patients and survivors. So we've got our two groups. We've got men on ADT and men not on ADT. And then we've really got 2 time points that we would look: during treatment and after treatment. And while there may be many barriers during treatment and men report not feeling well, what we've seen consistently in the literature is that if we can get people going during treatment, we can help alleviate some of the usual distressing symptoms that they see associated with treatment and improve going on after. For many men, though, they'll say it's just too hard, too nasty during treatment, and they prefer to start after. Okay, but what we can see is that many of the negative side effects associated with treatment, and again, that overall quality of life, are enhanced with exercise, whether it's done very gently while on treatment and then build it up with increases in fitness. So the news is good. Exercise does all of these things. What exercise does not do, it does not worsen treatment or disease-related symptoms, and it does not undermine treatment efficacy. So we often get asked with prostate cancer, well, you know, if I do something, if I'm riding a bike or putting pressure on my lower region, you know, is that going to increase tumor growth? Or if I exercise and the blood's circulating more, is that going to feed the tumor growth? Okay, there is no evidence that that will happen at all. to date. And there have been a lot of studies, and there's been rat models that they've looked at. And there was a few years ago, rat studies came out of Duke, and it was, oh, these rats that exercised saw increases in tumor growth, prostate-specific tumors. Okay? What that research didn't tell you in the sound bites that came out in the media was that these rats were running constantly 24 hours a day. So really high levels of intensity that would be unlike what any of us would do, hopefully, right? So, and it's a different model than the tumor in a human body. So I hope, if nothing else, you leave tonight with the knowledge that, you know, exercise may be helpful and it's not going to be harmful. Okay, following obviously some of the prescriptions we're going to tell you in terms of what's safe and what you should be doing. I just thought I'd share this headline here as well before we move into some of our resources. And this one didn't look at cancer specifically. But what this one really gets at is this whole idea of, for many of our ailments, we rely on drugs right now. And many of our drugs are very good. This study looked at specifically diabetes, heart disease, and 2 different musculoskeletal conditions. And in a review of this research, they found that exercise interventions in these populations were as good as the standard drug treatments in alleviating the symptoms associated with the conditions. Okay, so exercise really is that magic pill. Okay, it is something that we have complete control over. It's a little bit harder than just taking a pill, I'll give you that, but its benefits are as good as some of the traditional drug treatments that individuals go on for various conditions. So the good news is all that, and yet this is our reality. We avoid activity wherever and whenever possible. Many of us do. And the news isn't that great in cancer survivorship. So the research that has looked at this has shown that in this group, which has so much to potentially gain from being physically active, okay, the latest research showed that only about 22% of individuals are physically active. We have a higher rate than population norms for obesity, and we have very high rates of emotional distress well into cancer survivorship. So we're talking 5, 10, 15 years in, we still see many of the emotional distress issues. Okay, so while we know it's good for us, we're simply not following through and doing it. So on that, let's just take a little bit of a stretch. I'm going to show you another fun little video that I think gets at maybe some of the reasons why we don't do exercise. So before we do that, everybody just reach your hands up, wiggle your hands, say hello to the person next to you, put your hands down. You can open up through your chest a little bit, feel that nice stretch. Many of us are slouched. I see some bad posture out there. Yeah, sit up. Yep, there you go. Okay, back up again, and you can just take it side to side. Just nice little stretches. See, this is the movement that I'm talking about, getting to some of this end during the day instead of just sitting in your chair. You can just move a little bit. Roll your shoulders out. And I'm going to show you a fun video. If it'll load here. How many have seen this? Anybody seen this? Okay. hands up. How many of you engage in regular physical activity? You can see the definition up there. Awesome. Perfect. So throw out some things. What do you do? Walking, treadmill, biking, weightlifting, hiking, skiing. Awesome. We've had good snow this year. Water running in the pool. Golfing. Good. Golf's almost here. Tennis. Okay, how many of you choose things that you like to do because they're fun? A few of you, but less hands than when we're up before. Okay, and let's just think about it. Little kids, you watch them play, and they're playing and they're running around because it's fun. As soon as we get to be adults or teenagers, it's work to do, right? It's not the fun thing anymore. So I think that's one really important message, and that was just a fun little video, but I think it really hits the point that when we engage in something that we like, that we enjoy, maybe it's because we make it social, like golf with other people or meeting people in the water and do your running in the water, but if you can make it fun, you're going to be more likely to stick with it. And again, remember, you exercise, you have to be doing it consistently to get the benefits. So these are our current recommendations, and it's to engage in approximately 30 minutes of moderate to vigorous physical activity most days of the week. The guidelines are actually just that 150 minutes a week. Okay, but you can break it up. You can get small bouts throughout the day, 10 minute, 10 minute, 10 minute, and add it up as you saw in the video at the beginning. But you're supposed to do that. Then you're supposed to have at least 2 days of strength training. So how many men in here do the weight training? Hands up. A few of you, okay, and I'm gonna tell you a little bit more about that in a bit, but it's really important for men with prostate cancer to engage in weight training. So it is the one cancer population where we actually see a difference in the research between aerobic benefits and weight benefits. Okay, breast cancer, where most of our research is, we really don't see a whole lot of difference. It's just all good. Men with prostate cancer, and particularly if you're on hormone therapies, okay, exercise in the form of weight training adds above and beyond the benefits that we see with just cardiovascular aerobic activity. And then it's flexibility training, and that stretching we just did, the reaching up and rolling your shoulders, that's stretching, okay? And you should do that every single day. It says 3 to 4 days, but hopefully by the end of this, you'll be convinced that every day is good to do your stretching. Okay, so picking something you like and something that's fun, that's a really important first step. There's also a number of things that we know from the literature that can be really, really important in terms of enhancing the likelihood that you're going to stick with an exercise or a physical activity program. Number one over there, and we're going to talk about this more specifically when I tell you about what we do here, but it's finding the resources. So, you know, do you need somebody to show you exercises? Do you need a class to go to that's got like individuals? So maybe it's a class that has other people who like to engage in walking, or maybe it's a class with other prostate cancer survivors. Okay, we already talked a little bit about number two, what do you enjoy? If you pick something you like, you're going to be less likely to find excuses to talk yourself out of it when it's snowing, or when you're tired, or when you're trying to fit it in around appointments, right? The other part of that is to really acknowledge potential barriers and figure out how to work around it. So I'm going to tell you later about what we run at the university, and that's all great if you live near the university. But if you live way down in the south and you decide to commit to a class at the university, on those snowy winter days that we get in Calgary 8 to 9 months of the year, where you don't want to drive through all the traffic, you might decide, okay, I'm not going to go because it's just too far to drive, right? So thinking about the things that might stop you and how can you work around that is really important. I think this is the biggest one. Number 3, who's going to support you in engaging in your exercise plan or your physical activity on a daily basis? Okay, our research has really shown that individuals who have that support, again, are more likely to maintain this long term. Okay, so how many of you work out or engage in activity with somebody else? Hands up. So not so many. How many people like to do it on their own? Okay, and that's an important distinction, because really preference is what you like and enjoy is important, right? But what we have seen is that when we set it up so that individuals are in group settings, if that's what they enjoy, so there's individuals around them that they can get support from, or maybe you like to work out on your own, but it relies on your partner at home saying, okay, I'll get the cleanup at the end of the day so you can still get your 20 minutes of workout in. Or maybe you need somebody to drive you to a class. Or maybe you need, somebody to meet you there so you're accountable to somebody. Okay, those are all different forms of social support, and they're really key predictors for maintaining activity. The next two at the bottom are really practical things that you can do. And we're going to talk about them a little bit more. We've got a couple slides down the way here, but setting goals. You know, that can be just, I want to increase my activity minutes so that I'm getting 15 minutes every day of the week. Or it might be, I want to try a new activity. Or, hey, I want to do one of the runs or walks for cancer, so I'm going to set that as a long-term goal and set up mini goals to get there. Okay? And then the really practical scheduling it in. Whether you've got the smartphone with your calendar on it or whether you're a paper and pencil person, we know that as soon as you type/write something down, you become more committed to following through with that behavior. So actually scheduling it into your day is one way to get over that excuse of, I don't have time. Okay? If you watch the rest of that 23.5-hour video, you know, it really kind of hits home that we've got 24 hours in our day to get everything done, and we're only asking for 30 minutes out of that 24 for you to engage in activity. When you look at it that way, I think time becomes a less obvious kind of barrier. Okay, so those are some of the kind of first steps. I want to talk about some of the practical tools here. Monitoring exercise is really important. So I've told you that exercise is key for fighting fatigue. But really key is to exercise at an appropriate intensity. Okay, so you can take your heart rate, on your neck, you can take it on your wrist, and that's why many people do it. You can wear a fancy heart rate monitor, which individuals sometimes do as well. The one that we like to use in a very clinical, practical setting is this chart you see here, and it's called your rate of perceived exertion. So when you open your eyes in the morning and you haven't moved yet, you're at a 0. That's absolutely nothing. Sitting here in your chair is a 0.5 because you actually have to have some muscles to holding you upright. You're not slouching over like a piece of spaghetti, right? So right now you're actually working a little bit. Our goal in activity, depending on how you're feeling, depending on your fitness level coming in, can be anywhere from very light up to maybe somewhat hard to heavy if you're very, very fit. The key to not exacerbating fatigue is to make sure you're working out in a zone that's beyond your capacity. So if you're going through treatment and you're fatigued on a daily basis, you're probably never getting above a light to maybe moderate on a really good day. Okay, and so that's just a way of monitoring your intensity because the goal of exercise is to feel energized by the end of it and not more tired. Okay, so that's a really easy way to kind of monitor it. The other one that we like to do is the talk test. So when you're doing aerobic activity, you're walking, you're hiking, if you're golfing and you're not riding in the cart, all of those things, or in the pool, you should be able to carry out a conversation with somebody else, okay, without feeling like you really can't catch your breath. If you could sing happy birthday to the person that you're walking with, you can probably up your level a little bit because you've got extra lung capacity there to give, okay? So if you can sing, up your level. If you can't talk, dial it down a little bit. So these are just really practical tools to help you make sure that you're exercising at an appropriate level. Here's some kind of quick ideas where you can get movement, actual physical activity just into your everyday. A big one, we're going to see this at a little video clip I've got at the end, but it's parking further away. So how many of you go to the mall and you circle, 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 or you go to the Tom Baker or the Prostate Cancer Center and you circle to try to find that close parking spot to the door, right? We all do it. You see everybody at the mall always doing it, right? Okay, parking that little bit further away and walking for 1 extra minute. Okay, those minutes add up over your day. Taking the stairs, engaging in, right now it's, I guess, raking up our dead lawns, right? Or shoveling if the snow comes back. All of those things are a way to get physical activity again into your day. You don't have to be focused on going to the gym per se. And then again, as I've already mentioned a couple times, you need to maintain this, okay? So it's that Nike slogan of just do it, and it's that use it or lose it phenomenon, okay? So all of these great benefits of exercise, they do take a while to really build up to see some of the big fitness changes or some of the weight gain or weight maintenance improvements, okay? But unfortunately, they can leave you really quickly. So if you all of a sudden go to a sedentary lifestyle, all those gains will be wiped out in just a short time, okay? How many of you brushed your teeth this morning? Come on, everybody's hand better go up. We all brush our teeth every day, right? And why do we brush our teeth?
Freshen your mouth.
Freshen your mouth. What else? Why else do we brush our teeth? Healthy. Okay, so there's a health reason to brushing your teeth. What else?
Habit.
Who said it? Habit. Habit, right? It's the social norm. We're taught from a very young age, you just brush your teeth every day. That's the mindset I want you to leave tonight with exercise. It's not an extra. It's not something you're going to squeeze in when you can. It's the best thing you can do for your health. Okay, for your health at all levels, never mind cancer-specific health, but for all aspects of your health, exercise is the best thing you can do. So whether you get 10 minutes in a day and that's it, that's going to be better than nothing. But you need to change that mind frame from, oh, exercise is extra and oh, I'm too busy, so it'll be the first thing to go, to exercise is the norm for my health. Just like I won't skip brushing my teeth because not only am I going to have gross breath and scare everybody around me, right? But you need to make exercise that same mindset where it's a habit, whether you get it in the morning or at the end of the day or right in the middle of your day. It's something that you just do every day for your health. Okay, so tips for staying motivated. Got a couple here, I'll put them all up. So if we want you to keep going, we recognize that, you know, exercise is hard. It's not as easy as brushing your teeth. It's not as easy as just taking some sort of magic pill, right? Setting goals, signing up for classes or signing up for a run or a walk. Social support, so lots of things we've already talked about here. Tracking your exercise, I'm going to show you a couple tools. I will not promote or advocate for certain things, but I'll show you a couple of ones that we think are good. And then most important, coming back to that stairs video, if you enjoy it, you're gonna wanna do it on a regular basis. Okay, so I wanna touch on just a couple of these really quickly. So the setting goals. We wanna set new goals regularly, okay? Because we want to see ourselves achieve the goals, recognize that we can achieve our goals, celebrate achieving our goals, and then moving on and having our next goal. Goals are very, very motivational if they're set well. How many of you have heard of the term SMART goals? Has anybody heard that before? A couple people? Okay, so when you set a goal, we don't want to just say, I'm gonna lose 10 pounds. Because you know what, there's a lot of factors that can come into play if I'm gonna lose 10 pounds or not. More specific would be a goal such as, okay, way out there I wanna lose that 10 pounds, but what I wanna try to do is lose 1 pound every 2 weeks. And I'm gonna do that by watching what I eat, specific diet plan, and engaging in exercise. Okay, so you break it down. So when you have a SMART goal, it's very specific. What are you going to accomplish? So if we're talking exercise, maybe it's I'm going to get in a 10-minute walk every day, or maybe it's a 5-minute walk for starters. Okay, really specific. How will you know when you reach your goal? Make it a measurable goal. So make it within a time frame. Make it a certain duration or minutes. Make it a new activity that you have to sign up for. Make it have an end point so you can say, yay, I've achieved that, and then you can reset it. Make it attainable. That's a big one. So that weight loss, 10 pounds, 15 pounds, or hey, I'm going to achieve 150 minutes. If you're sedentary right now, getting to that 150 minutes can be a ways off because you want to build it up gradually. So break it down and set smaller attainable goals so that you can stay motivated. Hey, I want to get in 2 walks this week with my friend, and I can reward myself by then having coffee afterwards, right? Or having a little visit. Okay, so set it up so that they're attainable and realistic. Okay, that's really, really important. I know we can have these big, audacious goals that are out there and huge. Break it down into ones that are attainable and realistic, and again, timely. We always advocate setting new goals every 3 months or reevaluating your goals, see where you are, and adjusting as you need be so that you can stay motivated. Social support I've also touched on, so I'm just going to jump over this, but really considering who do you have for support, who can you ask? Sometimes people are just afraid to ask for that support, so asking for support so that you can more regularly engage in activity can be an important one. And then this is probably my favorite tool. I'm an iPhone person, so I like my iPhone, but I write everything down still. I'm a paper and pencil because, you know what, I've lost too many things on my iPhones over the years to really rely on that. So I set up a schedule for myself, whether it's for work or my kids or my own activity. And in all of our programs, we give people these paper calendars. And we tell them to take them, fill them out, write down their goals, write down what they're going to do on these days, and then put it on your mirror in your bathroom where you're going to brush your teeth every morning because it's your habit, so you're going to see it. Put it on your fridge where every time you open the fridge door, you're going to see it. Don't throw it in your bag. Don't put it on your desk that's all cluttered and has got 10 million other papers. You need to put this where you're going to see it every day because, again, when you look at that and you go, oh yeah, I was going to go to Wellspring and attend that class, or oh, I was going to go to the stretch and strength class at the Prostate Cancer Center. When you get those visual reminders, again, you're going to be more likely to actually try to do it. And then evaluating barriers. So the number one barrier that we all report is that we don't have the time. So again, watch the end of the 23.5-hour video, and I think you might change your mindset a little bit on that one. Time is often an excuse. Okay, if we really want to, we can figure out how we're going to fit in 10 minutes throughout our day or half an hour throughout our day. Okay, some of the others are more tangible or more real barriers, like lack of ability. Well, I don't know how to do the water running, so I'm not going to try that, right? Or I can't access that, or it's too far away to go to that class. So working around these barriers, figuring out strategies to avoid the barriers in the first place and to deal with them when they do come up. Because in real life, guess what? There are going to be days when you are too busy, or there are going to be days where it's snowing and you can't get to class. So what are you going to do to maintain your activity instead? And I think one of the areas where we're really going to start to see some change, and hopefully actual change in physical activity levels, is through the use of technology. How many of you have heard or use any sort of technology piece for your physical activity right now? Anybody? One? What do you use?
I don't use it, but my wife does.
Yeah? Perfect.
It has the wrist.
The wrist one, like a fuel band? Okay.
Quite interesting.
Yeah, so I mean, there are a number of really good ones out there. So I'm not promoting an individual product here. I'm just going to list kind of some of the options out there. There are tons of apps. So if you do have a smartphone or any of those and you like to be online, there are a lot of apps that can help you track your activity, that can help you schedule it in, whatever. The two that I am most familiar with are the Fitbit and the Nike Fuel Band. So if anybody wants to see, I've got my Fitbit on. It's this tiny little thing. I clip it onto my waist. I wear it every day, and it reminds me, even though I think I'm a very active person, on those days when I'm not even close to getting the number of steps that I should get. So does anybody know what the recommended daily step amount is? 10,000. Yeah, 10,000 steps. Okay, so today, I don't even know if I want to say this, I am at, oh, it's not even showing me. Oh, it just reset for some reason. Well, there you go, eh? Floor, 0. Normally it works quite well. Yeah, it just reset. So normally if I get my run in on a day, it will show that I'm above my 10,000 steps. On days where I don't get a run in and I'm at my desk most of the day or I'm driving in my car, I'm lucky if I hit 5,000 steps. And I think of myself as being active and moving around all day. So these are really nice reminders. If you've set a goal, maybe you're brand new to exercise and you're only trying to get 2,000 steps or then 5,000. I think these are great little tools. And the key that I really like about them, although it didn't obviously work right now because it shouldn't reset till midnight, is that they are so simple to use. Once you get this, you log in once on your computer and you're done. You have to charge it every once in a while. I walk into my room at home, it syncs and it sends me emails. It tells me what I did. It also connects me. So my dad's on one of these out west, my aunt's on one of these in the States, and we can connect online. And my dad will say, haha, I cut my grass today and I'm at 20,000 steps, right? So it becomes this little bit of a social motivation between us. So they're a really neat tool. The Nike Fuel Band works kind of the same way, except you wear it around your wrist, right? So there's a few different ones out there. I think they can be good motivational tools for you if you're needing that extra little bit of input or motivation or support. They can be really, really quite good. You can get these everywhere now, from Chapters to online. So if you go to fitbit.com, you can order it. They cost $99 on here. I think they're $90 now, actually. And they'll ship them right to your door. But Chapters has them. So you could buy them at Chapters. And there's other places. I think the Apple Store sells them as well at Market Mall, those sorts of places. So lots of places you can get them now. Yeah, Sport Check. All of those places have them as well. So they're kind of all, they've gone from having almost no presence about a year ago to they're all over the place now. And I think you'll start to see that more and more of these will be kind of come the norm for individuals to track their activity. So before we wrap it up talking about the local resources here, Dr. Heather Leach is going to come up and tell you about a trial that we are just starting that is supported by Prostate Cancer Canada.
Right. Hi guys. So now that you are all totally convinced that you need to exercise, we have a study that's just starting up that might help some of you who have not quite reached your exercise goals lately, or you haven't really been consistent in the last little while. So this study is a phase 2 randomized controlled trial. It's an economic analysis, so we're looking at the cost of 3 different exercise delivery methods, or 3 different types of exercise programs in men with prostate cancer who are on ADT. So when you join the study, you would get put into one of 3 groups, either a home-based exercise group, a group-based exercise group, or a supervised and individual one-on-one or personal training group. Sorry. Whoa. Oh, there we go. Oh, okay. Okay. Oh, and then I just explained that. And then as part of it, so not only are we looking at the cost, but also the role of the exercise professional, and then also how sort of the group dynamic works versus being at home or maybe with just one-on-one with a trainer. So we're also working with Toronto. So we're doing the study at the University of Calgary, and Toronto's also doing the study at the Princess Margaret Hospital. So in total, we're hoping to get 100 people in the total study. In Calgary, we're hoping to get 30. As I said, 3 intervention arms. The exercise program is for 24 weeks or for 6 months. And then we're also going to follow up with all of our participants for an extra 6 months. So you get an evaluation after your exercise program ends, because we want to make sure that you keep doing your exercise even after your program is finished. So we're specifically looking for men receiving ADT or hormone therapy, and that are going to be continuing on with hormone therapy for at least 6 months from the time they start the study. Participation in the study, you'll get a personalized fitness assessment from a certified exercise physiologist, so full fitness assessment, health assessment. Then you'll also get so regardless of which group you would get put in, you would get an individualized exercise program for 6 months, designed specifically for you by your certified exercise specialist. And then you'll also get reimbursed for any parking costs related to your fitness assessments at the University of Calgary. The group exercise and the personal training would take place either at the university or at the Richmond Road Diagnostic Center. Any questions about the study? And you guys can feel free to ask me afterwards as well. And just a reminder, so exercise does not mitigate any of the ADT side effects. And so far, no study has examined the best delivery model of exercise. So right now, we don't know which is better for guys with prostate cancer, whether it's personal training or in a group or at home. We also don't know which one will help you adhere to the exercise better. So after our intervention ends, which one is going to help you stick with it. And we also don't know which one is going to be the most cost effective. So this study is going to help us lay the foundations for a definitive phase 3, or something that we can really sustain and get into sort of the standard care practices of prostate cancer. And I think that's all for me. So yeah, if you have questions, you can shoot up your hand and ask, or you can ask us afterwards. We also have a sign-up sheet, and I'm hoping to leave a poster with some pull tabs so you can give us a call as well.
Okay, I'm just going to wrap it up talking about kind of what we've developed here at the University of Calgary and the resources. The goal of our lab at the university, we run trials like this one to build the evidence, but we're also very big and focused on translating that evidence into programs that we can leave and build in the community. And so really 2 pieces of that. We integrate with the cancer clinics, whether it's the Prostate Cancer Center or at the Tom Baker, so that we can streamline people so that they know about these resources after their treatments and they're back into their communities. And then we're big on supporting education of these fitness industries. So if you are a member at the Y or at the World Health or Gold's Gym or wherever you're going for your exercise, you're going to get somebody knowledgeable there who's been trained in the role of exercise for cancer survivors. So we have a number of programs out in the community. How many of you are familiar with Wellspring? A lot of you, some of you. Okay, Wellspring is an amazing resource in the city that's catered to cancer survivors and their support persons. We run exercise classes there, so all of the programs at Wellspring are free. We run classes there Monday, Wednesdays, and Fridays. It's a group-based setting. It's physio ball, you know, those big rubber balls that you can do exercises on. It's a circuit kind of setup for some classes. TheraBands, stretchy bands, so it's all very easy equipment that you could then translate into your own home-based setting. So that's a great place to start. If you're looking for some more support or a setting where you can get some information from a certified exercise professional or physiologist, that can be a great setting. Yoga is another program that we've translated from research out into the community. How many of you have ever done yoga? The ladies' hands goes up, right? Yeah, so we actually did a study with men with prostate cancer 2 years ago. One of my master's students did this. We actually recruited the women into the study and they brought their husbands. But what we found were enormous benefits for both the women, the support person, but also the men. And we have a number of these men who have continued on in our community-based program. So Yoga Thrive runs a number of classes throughout the city, registration. They run kind of 12-week waves. So we're in the middle of a session right now. And then the next 12-week wave will actually not start up until September. But you can get more information from our website, which we've got at the end of this here, so you can see that. Our Thrive program runs out of the university, and there's really two components to that. So we have a free fitness facility at the university that is just for cancer survivors. Okay, so it is a dedicated space, 100% free. You can come in, you can get structured physical activity supervision. So there are trained volunteers there who monitor the gym. Again, you can get some feedback. If you want more structured plan, an exercise plan, you don't want to come into a study, we have our Thrive program where it's a fee-based to cover the costs of our fitness professionals, and then they will give you a full assessment and design a program for you, and you can use the Thrive Center or wherever else you want. Some of the other programs in there, the beauty program, the peer, those are specific to different populations, breast cancer and pediatric oncology. But the Prostate Cancer Center, we have a program called Strength and Stretch. So it focuses on functional exercises and flexibility training, and it runs there once a week. So it's, again, a free class that you can check out. Small class size, 5 to 10 men max, and it runs on a weekly basis. I think now it's on Thursdays there at the Prostate Cancer Center. And the last thing I want to tell you about is this lifestyle management solution. So everybody in here, I'm sure, is very familiar with Movember, right? And all the funds raised, well, Prostate Cancer Canada and the ASAP network have started to distribute those funds, and we're actually leading the solution team on lifestyle management. So my research group and a team that we are in the midst of starting to pull together are going to be developing the solution nationwide for exercise, nutrition, and mindfulness stress reduction, education, and programming. So there's going to be a lot coming out of the University of Calgary, and Availbooks will pilot a lot here in Calgary. And one of the big things that's going to happen is that the Y is our partner. So how many of you access or have ever gone to a Y? Hands up, anybody access that? Okay, so you're going to see over the next year as we train and develop these programs that we'll have prostate-specific programs at the Ys in Calgary. So again, it'll be another really great resource, and we are going to be piloting here what goes right across the country, and that's all funded by Prostate Cancer Canada. So I'm going to leave you with this thought. So how many of you, again, stick your hand up if you think you're getting your 150 minutes a week of exercise? Okay, so there's room for improvement in the room. Okay, so I'm going to talk about how do we move from that couch potato, not getting as much as you should, to this really active lifestyle. And I've got one other quick video to show you, and then we're done. See if it pulls up here.
Hi, I'm Dr. Mike Evans. Usually I'm talking about the science behind best health, but today I want to start a movement called Let's Make Our Day Harder. I know that sounds counterintuitive. In fact, usually I'm asking, how can I make it easier to do the right thing? But let me explain. A recent review in JAMA Internal Medicine compared the health of baby boomers to previous generations. It showed what you might expect. Medical advances have led to longer life expectancies. But it also shows something else. U.S. baby boomers have more chronic disease, more obesity, and lower self-rated health than members of the previous generation at the same age, even though we smoke less and work out more than the Mad Men generation. So what's the difference? Well, I think for a variety of reasons that include technology, culture, and attitudes, we have a severe generational case of sitting disease. We watch phones, tablets, and TVs. We stare at computers while we work and pride ourselves on not moving for 4 hours straight. We don't walk to a friend's house or a coworker's office. We text them. I text my kids in my own house. Don't get me wrong, I love technology. There's lots of good to be had, but I also think we need to be mindful that as technology becomes more ubiquitous, it can loot the medicine chest of our single best treatment for good health, being active, moving. We shop on the internet instead of walking to the store. We have vacuums that automatically circulate so we don't have to. Electric toothbrushes so we don't have to move our hands up and down. With the push of a button, we can manipulate the TV, the music, the temperature.
We might even choose our house based on these conveniences or on the size of the TV room or garage, not walkability. Living further away gets you a bigger house, but it can also mean another half-hour day of sitting in your car. To compare ourselves to the recent low-tech, simpler past, let's look at the Amish. The average Amish dude walks 18,000 steps a day. The average Amish woman, 15,000. American men walk 7,200 steps a day and women 5,200. In Canada, we're a bit better, and I actually find these numbers a bit high, but 2009 data show 9,500 steps per day for men and 8,400 for women. Unfortunately, this drops by about 1,500 steps a day once we hit 60. I think it's time to change our prevailing attitude. Maybe easier isn't really better after all. So how's about you and I start a movement, an anti-pushing the button so the door opens automatically for us movement? I'm not talking about extra stuff like going to the gym or running. If you do that, it's great. I'm talking about the health goal of our daily habits, what I call tweak the week. It's about looking at your week and seeing where you can make it harder by taking the stairs or riding your bike or getting off a stop early on your daily commute. Have a walking meeting instead of sitting in a conference room. I had a 90-year-old patient tell me the other day that he gets off 2 floors above his floor. When I asked him why, he said, well, I can't go up the stairs too well anymore, but I can still go down. Can you flip technology and use your phone or other wearable to monitor and remind you to move or stand more? How about going for a walk at lunch instead of just going somewhere else to sit? Can you reframe buying a push mower or a rake or a snow shovel as an opportunity? Instead of driving around the parking lot for 10 minutes trying to find that spot that's 10 feet closer, can you just park farther away in that spot reserved for people who want to live longer and have a higher quality of life? Let's rethink this a bit. Let's you and I and our loved ones and our coworkers and our friends, let's all mix in a little low-tech into our high-tech. Let's do something that's totally in our control. Let's make our day harder.
So I think a good little message to end it off. Hopefully that will convince you that you could just move. Thanks. So I don't know if you can see that up there. I was just going to leave it up. So if you want, that's our website on there, and then the email is just wellnesslab@kin.ucalgary.ca. So if you have questions or comments or you want more information, you can feel free to email us at that and we'll get back to you. Okay, thanks.